Let's talk about breaking news first, and there's been a lot of discussion going on about young women with breast cancer on the rise. Let's talk about that.
Yeah, well, it's interesting. I've got the article right here. It came out a week or two ago in the Journal of the American Medical Association. And this was basically one of these reports. We talk about SEER data. In other words, the federal government, Lisa, collects data on the surveillance and end results of breast cancer and other cancers. SEER is the name of the database. So this is an analysis of that database, looking specifically at younger women under age 40, in their 20s up, let's say, to age 39, and looking at the increased incidence of sort of locally advanced breast cancers. In other words, coming in with a lot of local disease, even going elsewhere in their body. And as we know at Breast Cancer Answers, one of the big areas of interest that our audience has is what can we do to prevent breast cancer? What can we do to screen for breast cancer? All the other related things. Now, the jump here is not huge. What we don't want is panic in the streets right now. When we usually report the numbers per 100,000 people. And so when we look at the overall population, we're talking about over 100 per 100,000 people. And so in the time period that this was studied, from it's so dark in here I can hardly read my notes, from 1976 up through the mid-80s or so, the number jumped from 1.5 per 100,000 up to 2.9 per 100,000. So statistically, that's an important jump, but it's not the kind of thing that should panic women to want to go out at age 29 or 30 or 34 and start having mammograms, which is not one of the recommendations that comes out of this study.
Okay, but with that being said, and now that the average age for a mammogram is 50, what do you suggest for these women?
Well, as you know,
feeling a lump.
Right. As you know, we still have a lot of debate going on about what age we should start screening. It is still the recommendation of the American Cancer Society to start routine screening at age 40, not age 50, which is what the federal panel has suggested. Now, here's the difficulty. With younger women, first of all, they tend to be thinner. Their breasts tend to be more dense. And so the sensitivity of mammograms is clearly less in younger women. So to run off and start screening younger women right now makes absolutely no sense at all. But the real question then becomes, what can younger women do? And the number one thing that I'm going to recommend is that they do breast self-examination. They need to understand the contours of their own breasts. If they find a change that's different, then seek out, the appropriate medical advice for the appropriate. And usually in this younger age group, Lisa, we start off with breast ultrasound as the way to go, not starting to do x-rays of the breast. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.